This week's lecture material will be looking at the physiology of the female reproductive system, and information will be coming from chapter 28 in your textbook. Looking at the external genitalia of the female reproductive system, the vagina is the organ of copulation, and associated with the vaginal orifice are the ducts, or the opening of the ducts of the greater vestibular glands. The greater vestibular glands are homologous to the bulbal urethral glands in the male reproductive system, so they will secrete a mucus during sexual arousal and intercourse, which aids in lubricating the vaginal orifice. The clitoris is homologous to the penis in the male reproductive system, so the clitoris is composed of erectile tissue, and so similar to the penis during sexual arousal, parasympathetic nerve supply will cause a release of nitric oxide, which will remember, nitric oxide is a vasodilator, which will cause blood to engorge the clitoris, so it'll also become enlarged and engorged during sexual arousal. The labia majora in the female is homologous to the testicles in the male reproductive system. Looking at the different components of the female reproductive system, we'll start with the ovaries. The paired ovaries are the gonads of the female reproductive system, so similar to the testicles in the male reproductive system. The ovaries will produce the gametes, which are the eggs or ova, similar to the sperm in the male reproductive system. And as well, the ovaries will produce two female sex hormones, estrogen and progesterone, and as well two other hormones, inhibin, and we'll see the function of inhibin further on in the presentation, and the hormone relaxin. Relaxin is a hormone that's released during pregnancy that will increase the movement or flexibility of the pubic symphysis joints of the pelvis, and as well it'll relax the ligaments within the sacroiliac joints, so it allows the pelvis to open up during the birthing process. Next, we have the uterine tubes or fallopian tubes, and these are the tubes that will collect the egg that will be ovulated each month or ejected from the ovary, and that egg will enter into the uterine tube, and this is a tube that has ciliated epithelium, and the cilia will beat to move the egg within the tube. And the sperm, we'll see this is where the site of fertilization normally occurs, in the ampulla here of the fallopian or uterine tubes. And if that happens, if we have fertilization occurs, the fertilized egg will then be transported via the ciliated epithelium towards the uterus. And within the uterus, the fertilized egg will be implanted in the wall of the uterus, and this is where the development of the fetus occurs. The opening from the uterus into the vagina is called the cervix, and remember that the vagina is the organ of copulation, and as well it's the passageway for the birth, and as well the menstrual flow. So each month with the menstrual cycle, the endometrium or lining of the wall of the uterus here will shed, and that will exit through the vaginal canal. The wall of the uterus is composed of the endometrium, so that's the layer that is facing the lumen of the uterus, and the muscular layer is called the myometrium, and the myometrium then is the muscle component that will contract to aid in the birthing process. And you may have learned this already, that during birth it's the hormone oxytocin that's released by the posterior pituitary that will stimulate the myometrium to contract and to push the fetus out of the uterus. And if you remember that this is one of the few incidences of positive feedback control in the body, and with increasing muscular contractions of the myometrium, there's more oxytocin released that causes stronger contractions, and this continues until the fetus exits the uterus. We'll be looking at the two different cycles within the female reproductive system. So the events that occur within the ovary each month is known as the ovarian cycle, and the events that occur with the uterus each month is known as the menstrual cycle. And we'll see how these two cycles interact with each other. Of interest as well, note that the duct system of the female reproductive system, so sperm, for example, enters into the vagina, will be transported up into the uterus. Remember that prostaglandins in the semen will cause the uterus to undergo reverse peristalsis to try to get the sperm up into the fallopian tubes. The sperm have to make their way up into the fallopian tubes, and remember, fertilization usually occurs in the ampulla here. But notice here that the uterine tube opens out into the abdominal cavity or peritoneal cavity, and that it's not a closed connection between the ovary and the uterine tubes here. So the fimbriae are finger-like projections that basically are in space here. So when an egg is ovulated, it has to be gathered up by the fimbriae. And I'll post another video, a YouTube video that shows that process of ovulation and the fimbriae collecting the egg to bring it up into the uterine tube. But the significance of this as well is that because this uterine tube is open into the peritoneal cavity, it is a way that other pathogens can enter. So, for example, with sexually transmitted diseases, we can have a foreign antigen be brought in, enter into the tubes, and can actually get into the peritoneal cavity and create an inflammatory condition within the pelvis. So also you'll be learning about a condition called endometriosis, and again, this is allowed to happen because this is open to the peritoneal cavity here. It's not a closed duct system. Looking at a lateral view of the female reproductive anatomy, the clitoris, remember, is analogous to the male penis, so it's erectile tissue, and during sexual excitement, the parasympathetic nervous system stimulation will cause a release of nitric oxide, similar within the penis, that will vasodilate the blood vessels within the clitoris and create an engorgement of the erectile tissue. As well, with the parasympathetic stimulation, the breasts will also engorge with blood, and the vaginal mucosa will also increase its secretions. Recall also that the vestibular glands, the greater vestibular glands, are similar to the bulbourethral glands in males and will help to lubricate the vestibule, and also will facilitate the entry of the penis. Orgasm is due to a sympathetic nervous system response, same as in males, and this is going to result in an increase in blood pressure and also rhythmic contractions of the uterus. So that will help to propel the sperm up through the uterus and into the fallopian tubes. Recall that most often that this is where fertilization occurs, is in the ampulla of the fallopian tubes. Females of interest, females don't have a refractory period after orgasm, so they can experience multiple orgasms. And make sure you understand that orgasm is not essential for conception. So for successful fertilization of an egg, the female doesn't have to experience orgasm. Notice the location as well of the urinary bladder relative to the uterus, and you will understand why with pregnancy and the fetus enlarging, becoming larger and larger, that with increasing pressure on the urinary bladder, it's going to result in increasing frequency of urination. The bladder won't be able to expand as large. There's always a pressure on the urinary bladder, so pregnant women need to pee a lot. Oogenesis refers to the production of the female sex cells, or the ova. This is similar to spermatogenesis in males, producing the sperm, but a major difference is that in males, spermatogenesis doesn't begin until after puberty begins, whereas in females, oogenesis occurs in the fetal stage before birth. Again, a major difference is that males can continue to produce sperm and stem cells throughout life, whereas at birth, females will have the number of stem cells that they will have, and no more will be produced after birth. So looking at the events of oogenesis, we start with the oogonium, or the stem cells in the fetal stage. And just like the spermatogonia in the males, these are diploid cells, 46 chromosomes, 2N, and they will continue to divide by mitosis to create a population of these stem cells that can number somewhere in the 500,000 to 2 million stem cells. So these stem cells will then enter into meiosis 1 and will stall in prophase 1 of meiosis 1 and will stay in that phase or at that stage until puberty. Around these oocytes, which are known as primary oocytes now, that are arrested in prophase 1, we have follicle cells, and together these follicle cells with the primary oocyte are known as primordial follicles. So these primordial follicles are located within the ovaries and will stay in that state, arrested in prophase 1 of meiosis 1, through childhood, and then during adolescence, puberty, with changing hormone levels. Each month from puberty to menopause, there will be one of these primary oocytes or primordial follicles will be chosen to continue on and will go through meiosis 1. And this process will be stimulated by the release of follicle-stimulating hormone from the anterior pituitary. So a number of these primordial follicles will start to develop. One will be chosen, and this primordial follicle will continue to progress and eventually creating what's known as the vesicular or Graafian follicle. So one of these primordial follicles containing the primary oocyte will continue through meiosis 1. And as a result, after meiosis 1 is completed, this is all occurring within the ovary, we end up with a secondary oocyte that will then become arrested or will stop in metaphase 2 of meiosis 2. And as well, we'll end up with what's called a first polar body. So the polar body has 23 chromosomes, it's 1N, and the secondary oocyte will also have 23 chromosomes. The secondary oocyte will then be ovulated or ejected from the ovary. So this is the what occurs each month, the stage of ovulation. And this ovulated secondary oocyte will be collected by the fimbriae of the fallopian tubes and brought into the uterine tube. And if fertilization occurs, if the egg is fertilized by a sperm within the uterine tube, then the secondary oocyte will continue through meiosis 2 and to create the ovum, and as well we'll see another polar body that is produced as well. So the ovum will be a 23 chromosome haploid structure, and this will only occur if sperm fertilizes the egg. So meiosis 2 will then be completed. And also notice that the first polar body may also go through meiosis 2 to create another polar body. So an important difference between males' spermatogenesis and females' oogenesis is that from one egg, or from one stem cell, or from one primary oocyte, in females you will only end up with one viable ova and 3 polar bodies that will then degenerate. Whereas in males, you start off with one stem cell or primary spermatocyte that will then progress to create 4 viable sperm. Looking at the events of oogenesis within the ovaries, remember this all takes place within the ovaries. So starting with the primordial follicles, these are the structures that are present at birth and containing the primary oocytes that are arrested in prophase 1 of meiosis 1. And remember that there's approximately 500,000 to 2 million of these primordial follicles in the ovary. So these will remain inactive through childhood, and then during puberty each month with rising levels of follicle stimulating hormone, a number of these primary follicles, primordial follicles, will be stimulated to grow, and eventually one will be chosen to continue on, and it will go through complete meiosis 1. And as a result, you'll have one polar body, or the first polar body will be produced, and as well you'll have a secondary follicle or secondary oocyte within a secondary follicle. The secondary oocyte then will enter into meiosis 2, and then will stall in meiosis 2 at the metaphase 2 stage. So this one now will continue on to become what's known as a vesicular or Graafian follicle that contains the secondary oocyte arrested in meiosis 2. And then approximately mid-cycle of the ovarian cycle, we'll look at the ovarian cycle in more detail. There's a surge of luteinizing hormone from the anterior pituitary that will stimulate the phase of ovulation. So ovulation refers to the ejection of the secondary oocyte from the Graafian follicle. And it's this secondary oocyte that is stalled in meiosis 2 that will be collected by the fimbriae of the fallopian tubes and brought into the uterine tubes. And if this secondary oocyte is fertilized by a sperm, it will then go through complete meiosis 2 and to become the zygote or the fertilized egg, and as well another second polar body will be produced as well. The follicular cells that are left behind at ovulation continue on to become the corpus luteum. The corpus luteum is an important structure. It produces the hormone progesterone, and we'll see what the function of this hormone is in the menstrual cycle. And this will persist for approximately 10 days, the corpus luteum, and if an egg is not fertilized by a sperm, the corpus luteum will degenerate into scar tissue known as the corpus albicans. The ovarian cycle is a series of events that occur within the ovary approximately on a monthly basis that will end up with a secondary oocyte being ovulated approximately mid-cycle. This ovarian cycle begins with the hypothalamus releasing gonadotropin releasing hormone, GnRH, which will then act on the anterior pituitary, and the anterior pituitary will then release the hormone follicle stimulating hormone, FSH, and luteinizing hormone, LH. These two hormones then will act on the ovary, and FSH in particular will act on the primordial follicles and will stimulate a number of them to start to develop. And recall that one of them eventually will continue to develop into the secondary follicle or secondary oocyte. And as the follicle is developing, it will start releasing the hormone estrogen as well as the hormone inhibin. Both of these hormones will then also act on the hypothalamus and pituitary as a negative feedback mechanism to stop these structures from releasing follicle stimulating and luteinizing hormone. And this makes sense because once we have the secondary follicle progressing within the ovary, we want to stop the development of any more primordial or primary follicles. Approximately mid-cycle, there is a surge of estrogen from the secondary follicle that will act on the pituitary to release a surge of luteinizing hormone. Both luteinizing and follicle stimulating hormone, follicle stimulating hormone are released, but there's a surge of luteinizing hormone that will then stimulate ovulation. So you need to know that ovulation is stimulated by a surge of luteinizing hormone. So this results in the secondary oocyte being ovulated, ejected from the ovary, And remember that the follicular cells that remain behind in the ovary become the corpus luteum. The corpus luteum then will be secreting the hormones progesterone as well as estrogen and inhibin. And again, these will act as a negative feedback on the hypothalamus and the pituitary, telling those structures to stop releasing follicle stimulating hormone and luteinizing hormone. As long as the corpus luteum is persisting, we want to wait until we see whether there has been fertilization of the secondary oocyte. And if fertilization does occur and the egg becomes implanted in the uterine wall, the corpus luteum will persist and continue to secrete these hormones. So if that is going to happen, we don't want the pituitary to release more follicle stimulating hormone. We don't want any more follicles stimulated to develop within the ovary until we see whether we have got a fertilized egg that is implanted in the uterus. There are 3 phases to the ovarian cycle. There's the follicular phase, ovulation, and the luteal phase. The follicular phase refers to the first day, 14 days, day 1 to 14, as the follicle is developing. And remember that this is going to be stimulated primarily by follicle stimulating hormone. So we're getting to the point of making the Graafian follicle, which will then enter into ovulation. Remember also, as this follicle is developing, that it's releasing the hormone estrogen. Ovulation then occurs mid-cycle at day 14, and this is due to a surge in luteinizing hormone from the anterior pituitary, and that will cause the secondary oocyte to be ejected from the Graafian follicle. Some women apparently are able to feel this process of ovulation. It creates a little twinge of pain that's known as Mittelschmerz. Sometimes as well, more than one egg will be ovulated, and if 2 eggs are ovulated and are both fertilized by sperm, will create the non-identical fraternal twins. The third stage lasts from days 14 to 28, and it's known as the luteal phase, and that refers to the formation of the corpus luteum. So this is the follicular cells that are left behind after the ejection of the secondary oocyte. And recall that this structure also is going to be secreting the hormones progesterone and estrogen. This phase is primarily triggered by luteinizing hormone, so this is where luteinizing hormone gets its name from. It's integral in the formation of the corpus luteum. The corpus luteum will persist for approximately 10 days. If fertilization does not occur, then the corpus luteum will degenerate to become scar tissue known as the corpus albicans. If fertilization does occur, the corpus luteum will persist and will continue to secrete hormones, progesterone and estrogen, for up to 3 months until the developing placenta takes over that role. These 2 graphs will illustrate the fluctuating hormone levels that occur during the ovarian cycle. The top graph here, we see that in the follicular phase, so if we look at the timeline on these graphs, the first part here will be the follicular phase. The spike here that we see in luteinizing hormone is going to be the ovulation, and then post-ovulation will be the luteal phase. So in the follicular phase here, we have rising levels of LH and FSH released from the anterior pituitary. And remember that follicle stimulating hormone is going to be stimulating the development of the follicles within the primordial follicles within the ovary. One will be chosen to continue on. And recall, as the follicle is developing, it's going to be secreting estrogen. Just before ovulation, the follicle will release a surge of estrogen that will then act on the pituitary, causing the pituitary to release a surge of luteinizing hormone, as well as some increased level of follicle stimulating hormone, but it's the surge of luteinizing hormone that will stimulate ovulation. And then now, after ovulation, we're into the luteal phase, and remember that the corpus luteum will then start secreting progesterone, the hormone progesterone, and as well as estrogen. And it'll continue to secrete these two hormones as long as it stays alive. As puberty nears in the female, gonadotropin releasing hormone is being released from the hypothalamus, which will cause a release of the follicle stimulating and luteinizing hormones from the pituitary. And this will continue for a while until there's an actual cycle that's established. And then there will be the first episode of menstrual bleeding, which is known as menarche, and this is the official start of puberty. The menstrual or uterine cycle is the events that occur within the uterus, and again is approximately 28 days long and is also divided into 3 phases. The first phase is menses, or the menstrual phase, and this will be days 1 to 5. And this will be stimulated by the death of the corpus luteum, and we'll see this in more detail. The second phase is the proliferative phase, so this will go from days 5 until 14, until ovulation. And this is primarily stimulated by the hormone estrogen. And the third phase, from days 14 to days 28, will be the secretory phase, and this phase is stimulated by the hormone progesterone that's being secreted by the corpus luteum. The 2 definitions you should know are amenorrhea and menopause. Amenorrhea refers to the absence of a menstrual cycle, and menopause refers to that period in a woman's life when the menstrual cycle stops, and usually occurs in the late 40s, early to mid 50s age range. If an egg is fertilized by a sperm, remember that this normally occurs in the ampulla of the uterine tube. The developing zygote now will make its way towards the uterus, and after approximately 5 days it'll arrive at the uterus, and it'll embed itself in the wall of the uterus, in the endometrial layer, and there it'll stay and develop through the term of the pregnancy. If we look at the cross-section of the endometrial wall here, we see that there are glands, they're called secretory glands, that will secrete a nourishing fluid to help keep the fetus nourished and fed, and stuff including glycogen will be secreted by these glands. And as well, we have particular types of arteries that we see in the endometrial wall, and of significance are these spiral or coiled arteries. So if we have a zygote that implants itself in the endometrium here, this endometrial layer will stay intact and will continue to support and nourish the developing fetus. If there is no fertilization of an egg and no implantation of a zygote in the wall of the endometrium, there are events that will occur that will result in the death of this endometrial tissue. So basically what happens is that these coiled arteries will kink, and as a result, blood flow to the endometrial tissue here will stop, and this tissue will die, and this will result in this layer, this endometrial layer of the wall of the uterus will slough off, and then will exit the body through the vaginal canal. So this is the 5 days of menses, or menstruation. This is the first phase of the menstrual cycle. So day 1 of the menstrual cycle is the first day of bleeding, which is due to the death of this endometrial tissue and also being sloughed off and exiting the body through the vaginal canal. We now have to correlate the events that happen within the ovary and the ovarian cycle with the events that occur with the uterine or menstrual cycle. So if we look at what happens within the uterus first, the menstrual phase, day 1, remember, is the first day of bleeding. So this is due to the endometrium layer dying off and being sloughed off and being bled out through the vaginal canal. So this will correlate with the early stage within the follicular phase in the ovary. And recall that as the follicle is developing in the follicular phase, it's going to start releasing the hormone estrogen. Estrogen will then have the function of rebuilding the endometrial tissue that was lost during menstruation. So the proliferative phase of the uterine cycle refers to the proliferation or the rebuilding of the endometrial tissue, and primarily due to the action of estrogen. Day 14, recall, is going to be ovulation, right? So ovulation is going to occur due to a surge of luteinizing hormone. The secondary oocyte will be ejected from the ovary. And then remember now that in the presence of luteinizing hormone, it'll form the corpus luteum. And recall that the corpus luteum now will start to secrete progesterone, as well as continue to secrete estrogen. And now if we look at the uterine cycle, we now enter into the secretory phase. And the secretory phase refers to the rebuilding of the secretory glands that are going to help to nourish. If there's an implantation of the zygote, we need the nourishment that the fluid is providing from these secretory glands. So the progesterone that is being secreted by the corpus luteum in the luteal phase is going to rebuild the secretory glands in the uterine wall. And so this is called the secretory phase. If fertilization does not occur, so there is no zygote that's going to implant itself in the wall of the uterus, and the corpus luteum, remember, will degenerate after approximately 10 days within the ovary. Therefore, there is no more progesterone being secreted or estrogen, and this will cause the spiral arteries in the endometrial tissue here to kink, and as a result, blood flow to this part of the endometrium will stop. This tissue will die, and again will slough off the uterine wall, and this will establish the first day again of the menstrual phase of the uterine cycle. So the first day of bleeding is day 1 of the menstrual cycle. If fertilization does occur and a zygote makes its way to the uterus and embeds itself in the wall of the uterus, in the endometrium, the zygote will then start secreting another hormone that's called human chorionic gonadotropin, HCG. Human chorionic gonadotropin will then act on the corpus luteum to keep it alive within the ovary. And as a result, the corpus luteum will continue to secrete progesterone and estrogen, and will keep the endometrial tissue alive. So these spiral arteries won't kink, there won't be loss of blood flow to this layer of the endometrium, and menses will not occur. This image then will put all the components of the ovarian and menstrual cycles as well as the gonadotropins that are being released from the pituitary gland. So remember, in the follicular stage within the ovary, as the follicle is developing, this is due to increasing levels of follicle stimulating hormone and luteinizing hormone from the pituitary. And remember also, as the follicle is developing in the ovary, that it's releasing estrogen. So we see that the estrogen levels are rising here. And notice that progesterone is not doing anything at this point, because it's not until the corpus luteum is formed that progesterone is released. Estrogen then will act on the rebuilding, or will help to rebuild the endometrial layer that was lost during menses. So during the proliferative phase of the menstrual cycle, we're rebuilding, proliferating the endometrial tissue, and that's primarily due to the rising levels of estrogen. Remember, just before day 14, there's a surge of estrogen that will cause a surge of luteinizing hormone from the pituitary that will stimulate ovulation. Ovulation then, after ovulation, we have the development of the corpus luteum within the ovary. And remember that this is due to the presence of luteinizing hormones. So now we're in the luteal phase of the ovarian cycle. The corpus luteum will then start secreting progesterone and estrogen, and we see now progesterone levels are elevated here. And remember that progesterone now is important in rebuilding the secretory glands of the endometrial wall. So this is the secretory phase of the menstrual cycle. And together, progesterone and estrogen will keep the endometrial healthy as long as the corpus luteum is alive. If the corpus luteum dies after 10 days because there hasn't been fertilization, then the spiral arteries will kink in the endometrial tissue, and the tissue will die, and we start the 5 days of menses, where we slough off the endometrial lining. And remember again that if fertilization does occur, and the zygote implants itself in the wall of the endometrium, it will then start secreting human chorionic gonadotropin. Human chorionic gonadotropin will keep the corpus luteum alive, and it'll continue now to secrete progesterone and estrogen to keep the endometrial tissue healthy. Like testosterone, estrogen is an anabolic hormone, which means it builds things up in the body. As levels of estrogen rise during puberty, it will exert these anabolic effects on the female reproductive tract so that the different components of the female reproductive system become more functional and larger as well. The vaginal mucosa will thicken, and the external genitalia will also mature due to the effects of estrogen. Increased size of the breasts, increased deposition of the subcutaneous fat, so especially in the hips and the breasts of the female will be stimulated by estrogen, as well as widening and lightening of the pelvis and growth of axillary and pubic hair. When ovulation and menses cease entirely, the woman enters into menopause. There's typically a premenopausal period where the cycles will start to become intermittent, but it's not until these cycles stop totally that this is considered to be menopause. So this occurs, as this is occurring, there is a decreasing levels of estrogen in the body, and as a result, it'll have its effect on the reproductive organs and the breasts. There tends to be atrophy of the tissues. And there can be also some mood disorders associated with that, irritability and depression. The blood vessels in the skin will undergo a vasodilation that will create hot flashes. And as well, estrogen has a protective effect against osteoporosis. So with loss of estrogen, there's a increasing loss of bone, and as well a thinning of the skin is noticed as well. Estrogen also has a very protective effect against cardiovascular disease, and so we see that women who are premenopausal have a strong protection against cardiovascular disease, heart attack, stroke. But once estrogen levels are dropping, their risks of developing stroke or heart attack start to increase, and shortly after menopause will achieve the same risk levels as males. In the pregnant female, the mammary glands will be stimulated to increase production of milk by both progesterone and the hormone prolactin. Prolactin is a hormone that's released from the anterior pituitary. Oxytocin is another hormone that is released by the posterior pituitary, and its function in the lactating mammary gland is to increase the ejection of milk from the nipple.